Hi, everyone. My name is Audrey Loper, and I'm an implementation specialist at the National Implementation Research Network, or NERN, at the University of North Carolina at Chapel Hill. Today, I'm joined by Ruben Para-Cardona and Ofelia Zapata, co-authors of the SSIR article, Faith-Based Organizations as Leaders of Equitable Implementation. In this article, Ruben, Ofelia, and their co-authors describe their work adapting a parent intervention to be more responsive to the needs of underserved immigrant communities and the critical role that San Jose Catholic Church played in that implementation. So Ruben and Ofelia, welcome. I'd love for you both to introduce yourself. And Ruben, if you wouldn't mind also sharing a bit about your co-authors who weren't able to join us today.
Absolutely. Hello, everyone. It's a pleasure to be here with you today. My name is Ruben Para-Cardona. I'm an associate professor in the Steve Hicks School of Social Work at the University of Texas at Austin. And I'm also area director for research at the Latino Research Institute at the same university. Our co-authors are Father Sandoval Pliego, who's the leader of the San Jose Catholic Church here in Austin, Maria Emerson, who's co-director of Social Justice Ministry at San Jose Catholic Church, and also Delia Garcia, who is Director of International Projects and Emerging Issues at the Migrant Clinician Network.
Hello, my name is Ofelia Zapata. I am the co-founder of the Social Justice Ministry of San Jose Catholic Church.
Thanks again so much to both of you for joining me for this discussion. So cultural adaptation is one of the key tenets of equitable implementation. Ruben, I'm wondering if you could start us off by telling us a little bit about the parenting intervention that your team adapted. What is it designed to do, and what changes were needed to make it a better fit for Austin?
Yes, we have been adapting this intervention for 15 years, primarily with funding support from the National Institute of Health. First, the National Institute of Mental Health. In the first study, we demonstrated that it's essential to address discrimination and the way discrimination impacts parenting practices. By doing this, we demonstrated that when you overtly address discrimination in a parenting intervention, evidence-based parenting intervention, you improve parenting practices as well as child mental health. And adaptation is essential because the intervention we deliver was originally developed with Euro-American populations. If you don't do adaptation, you run the risk of falling into scientific imperialism because you don't respond to the cultural values and traditions of the focus populations you are working with, in our case, Latino immigrant populations. As we moved to Austin, because those initial studies were conducted in Michigan, we had to adapt for the context of Austin, the challenges that we face in this context, the resources we have here, as well as the fact that in this particular study, we are addressing substance use prevention in a limited number of sessions to respond to our founders, the National Institute on Drug Abuse.
So Ruben, you just described some changes that were made to the intervention itself. What changes did you need to make when implementing the curriculum? So did you shift any of your implementation strategies for this context?
Yeah, that's essential and a very nice and important distinction between the intervention content and the implementation strategies. I think addressing the co-leadership in the community has been essential. It's been a slow moving project because every step along the way, we have worked hand in hand with the amazing leadership by Ofelia and her team in the design and implementation of the intervention. Also, we are gradually involving parents as interventionists, but that's a long process because they first need to know the intervention, then they need to get trained in the intervention, and then they need to get trained to be delivering that in a group format. That is going to get a multi-year process. Advocacy is essential for us. That means that every family that gets involved in the project will have access to social work services, because it does not help if they are in a parenting group, but they are hungry, if they have immigration challenges that they don't have support for. So providing that level of support in the form of advocacy is essential. And finally, sustainability. That's essential. How is it that you ground an intervention in the community for the long run? Having members of the community as interventionists is one way of doing it, but another one is going to be the financial sustainability. That's why we will launch an arm of the study that will be focused on having conversations with business leaders to help us address that challenge and that objective of this study.
Thanks so much, Ruben. Ofelia, San Jose Catholic Church was a critical partner in implementing the parenting intervention. Can you tell us a little bit more about the church's role?
So the partnership we committed to was that first we needed to get our priest, Father Heido, to endorse this partnership.
Mm.
It's so important in the church to have the main leader to support us so that we can do pulpit announcements, we do recruitment. Father also includes the program in homilies to
Mm.
encourage people to participate. So it's getting the people together, informed, and see who's interested in participating in the project.
That's so amazing that you've got such a great champion right there at the church. So, from your perspective, what made the church the ideal partner for reaching the Latino immigrant community in Austin, as opposed to, let's say, other organizations in the community?
Well, I was just really blessed to meet Dr. Para at a meeting here at UT, at a different meeting. And when I learned about the intervention program, the parenting program, I was so excited because we had been having meetings with the members, and the number one issue that kept coming up was alcohol and drug abuse
Mm.
among adults and the children. And we've been hearing that for the last 9 years, and we could not find a partner to work with. And so we were very excited to be able to offer this opportunity so that parents can begin to begin to learn some new techniques on how to discourage and support their children.
Well, it's so wonderful that you found each other.
Yes, we're very blessed.
So we know that implementation usually involves a few surprises along the way. What challenges did you encounter as you were both adapting and implementing the program, and how did you manage those challenges?
I think on my part, I spent almost 15 years at a public institution in Michigan in the Midwest. So I had a friend of mine in terms of that experience. Coming to a public institution in Texas was completely different. So I think that was the first level of challenge that I experienced, being in a public university in the state of Texas with a whole different set of expectation and administrative challenges. That was a big challenge on my part. Also, learning about the dynamics of discrimination here in Austin, in a city that is known as being liberal and very open-minded, but the level of work exploitation that I have witnessed here is very severe, as well as the discrimination of Latino citizens against Latinos. And finally, the challenges that we faced with COVID. We originally thought the whole program of research and this study to be in person, and we had to completely shift to a virtual approach. So that was a major challenge that we experienced as well.
Yeah.
And for the church, we are the largest Latino immigrant community church that has 5,000 families. And so the challenge was, being able to only get a few parents to participate at the beginning, and the need to do small groups so that we can have some real strong intervention conversations going on. So I think that's the challenge that everybody wants to get in, but we have to limit. And for very good reasons. I think the other challenge is, the COVID. A lot of the families don't know internet, don't know how to use the technology. And so it was beautiful that Ruben and his team, the first day was learning how to do Zoom. That was so important. And that really helped the families to learn how to participate.
As we close out our conversation today, I'd love for you both to reflect on your experience adapting your program in partnership with the faith-based community. If you were mentoring another group that wanted to do something similar, what advice would you give them? And Ophelia, why don't we start with you?
Well, you welcome everyone because it's not limited to just a certain group of people. So in a church setting, it's important to be inclusive. And so it was a challenge because there's so many people, and so that's the difficulty. But I guess the other challenge was the members of the church, a lot of them were not involved in church. As a matter of fact, some of them were not really frequent, you know, they would go because of work. But all that changed even after the program. They were more wanting to be in church and be more in community, build relationships with each other, you know. So even though it looked a little challenging at the beginning, it really was a plus for the community to get stronger together.
And I think on my part, to be inspired by your colleagues, when we run the focus groups to understand dynamics of discrimination in Austin, you should have seen before we went into the room, Ophelia and her team running immigration workshops with undocumented immigrant or mixed status immigrant families. And the attorneys were in there giving them advice about what would happen if they were arrested and deported. And seeing that level of commitment and being in the trenches with such a hard reality was so inspiring to me. As well as when we did the first recruitment, it was on a Sunday morning at 8 a.m. I did not think we were going to have people, and the church was packed with families, their children all dressed up. They just had that presence with that faith and commitment. So being inspired by Ophelia and her team and the leadership of Father Jairo, as well as the Latino immigrant community that we were serving, was essential. I will also say, know your institution as a PI, the barriers, and communicate about all of them constantly with complete transparency to your team. And that will just lead to embracing trust for both parties, because there will be delays, there will be challenges, but as long as you keep the communication open, that is what is going to keep your team being strong and the project being strong.
And I just would like to close that Ruben's team has been amazing. You know, they just have this positive energy that really keeps parents engaged, and they come back. I mean, the commitment is 10 weeks, and we rarely had anyone miss. They really were inspired by the team. So thank you.
Well, thank you both for your time today. It was an absolute pleasure talking with both of you. Thank you so much.
Thank you so much for the opportunity.
Yes.
It's been great.